Hello, my name's Jo and I'm a counsellor. Today I'm just going to give a brief talk on anxiety for patients living with long-term lung conditions. Anxiety is actually a very normal part of life. Anxiety can come when we're excited for something or nervous for something, perhaps an interview. But when we're living with long-term lung conditions, we obviously have some quite significant physical symptoms, one of which is shortness of breath. And unfortunately, when anxiety increases, whether that's mild, medium or quite severe, shortness of breath is actually one of the components that makes us feel quite fearful. So with that exacerbating your lung condition, often patients talk to me about feeling panicky, and some people call them panic attacks. Anxiety, although unpleasant, isn't harmful. In fact, it's nature's way of keeping one safe. You might have heard the term flight or fight. And that's actually when the adrenaline courses through our body, affecting certain organs and giving us a way of actually escaping something that we perceive to be unhelpful, or actually to stay and fight. Now, in certain conditions, if you're running a marathon or you're being chased by a tiger, then that role of the adrenaline would be very, very useful. But unfortunately, when we're just sitting watching a soap opera or reading a magazine and that anxiety starts and we're actually not sure where it comes from, it can feel really overwhelming. Patients talk to me about palpitations, shortness of breath or gasping, a horrible feeling in their tummy, a bit like butterflies. And some people say it feels as though something awful is going to happen. And the more we concentrate on those symptoms, the more the anxiety feels to grow. So what can help us when we're dealing with anxiety? Well, as I said earlier, unfortunately, we can't take a tablet or switch a switch because it's part of our human makeup. But what we can do is actually learn to accept that although it's unpleasant, it's not going to harm us. Unfortunately, when we have physical symptoms, our cognitions, our thought processes certainly link into those. And patients say to me, I have thoughts, Jo, like, oh my goodness, I'm going to die. And that's perhaps a severe end, but that actually can happen, that thought process. So it's about learning about the physiology of anxiety, knowing that in a bizarre way it's there to keep you safe, but also knowing how to relax, how to slow down your breathing, and trying to be mindful and in the moment and not get hooked up on those thoughts of, oh my goodness, what if this is going to happen? So actually, what I would talk to patients about is learning to relax, slowing down their breathing, as I said. Sometimes putting their hand on their tummy and make sure that they're breathing from their diaphragm rather than their chest. And actually focusing on things perhaps in the room, bringing it back to the here and now. Anxiety can also be helped by doing things. So many patients say to me, Jo, since I've had anxiety or I had one panic attack, I've stopped going out. And their thought process then is, if I go to the bingo or I walk to the bus stop, this is going to happen again. And of course, there's no evidence it will. And if it does, it's best that the patient deals with it. That can be by distraction, perhaps sitting on the bus and looking out the window and you're starting to have these symptoms of uneasiness. Count every red car count backwards from 100, do an alphabet game. A is for apple, B is banana, anything to distract yourself from unhelpful thoughts. I would also say that if anxiety does become part of you too much, what tends to happen is actually patients avoid doing things, and unfortunately that means that they're sitting more and getting deconditioned. And of course the holistic care for patients is obviously pulmonary rehab, exercise, and also looking after your mental health. So if anxiety becomes too problematic and it's stopping you living, I strongly advise you to talk to a health professional. It might be your pulmonary rehab team who can refer you into our psychology department, or it might be a friend, but talk to somebody.